Hi, this is your Chief Science Officer, Brazos Minshew. Welcome to Wellness Talks. Today we have the return of a very special guest here on Wellness Talks. We have our guest, Dr. Judy. And welcome to our program today.
Thank you. I'm so happy to be here.
Dr. Judy, as you may know, is a licensed counseling psychologist as well as being the emotional wellness contributor to the Vita Journal, a publication that many of you probably receive. And so we actually had some things on emotional wellness that we wanted to talk with Dr. Judy about today. Specifically, we want to talk about the subject of anxiety.
Nobody has that, Brazos.
There you go. Yeah. For the rare few people who may once in a while feel anxious, for example, when they're being interviewed on a camera.
Exactly.
We want to be able to help us define what anxiety actually is and maybe give us some strategies for how each one of us might be able to cope with anxiety and anxious states that we feel from time to time. So maybe you can help us. What is anxiety, and perhaps how do people of different kinds, how do people experience it differently?
Well, I'd like to just make it really simple and basically say that anxiety is that uneasy feeling in the mind when you think something bad is going to happen to you. You know, you just get that feeling that there is something lurking around the corner that is going to happen, and you're fearful about it or worried about it. So usually it's accompanied with either worry or fear, and it can become very excessive, where the worry just, begins to dominate your day, and the fear builds up until the body begins to respond when this happens. So that's when it really becomes a problem, because right here and now I have sweaty palms. Anytime you're giving a presentation or you're up in front of a group, you're going to feel you'll feel that sweaty palms, and your heart will race just a little bit, and that's normal. Everybody has that feeling and that sense at times when they're doing something that's not usual. And so they're going to have that. But if you allow anxiety to build up, this is when it really becomes a problem, because your heart doesn't just race, it begins to pound in your chest. Okay. And you feel like it's literally going to fly out of the chest because it's pounding so hard. And then your breathing becomes labored and it's difficult to do. And so as these symptoms build up, then nausea happens and so many other symptoms begin to just pour out of you. And at some point, you feel like you're losing your mind because anxiety has taken over. And I know people that have felt like they were dying as well when they have anxiety attacks.
So could we start off by saying then that anxiety is borrowing worry from the future? Right?
Absolutely.
It is a future, it's a future anticipation, perhaps, kind of a pathological anticipation.
Of something bad going to happen.
Of something bad, yeah. It's so funny that we don't ever get anxious about good things happening. It's always something bad happening.
Yes, exactly.
Okay, so the next thing is that in the short term, if I heard you correctly, in the short term, anxiety is not something that's really bad for us, but can perhaps help us solve some problems or deal with a circumstance like being on camera, or going on a date, as I mentioned, right?
Yes.
But it's when it becomes prolonged that it becomes a serious threat to our physical health?
Absolutely. After a while, if you've not learned how to manage that anxiety, it just builds up inside of you to the point where it becomes an emotional state that you're creating then physical conditions in your body. It'll turn into physical illnesses. So, we have to get a hold of it right away so that we're treating that anxiety and it doesn't turn into an emotional state that creates physical conditions. And some of those physical conditions that you might see, just right away is migraine headaches. People suffer from migraines from anxiety, and then it moves into the respiratory area of our body with allergies and asthma, a lot of different things this way, gastrointestinal issues. It just begins to, attack and take charge of the whole body, because the body is breaking down from this state, that always alert state, just being pouring all of the adrenaline into the system. And so pretty soon the body just can't handle it anymore. And then you have these disorders that begin to take place in the body, even thyroid problems. There's just a lot of different things, arthritis, that come from these things.
Yes, so hormonal disorders. Autoimmune?
Definitely. Yes, definitely.
As the immune system is disrupted by the anxiety, right? So let me see if I can recap some of that. Anxiety creates cardiovascular disorders, creates gastrointestinal digestive disorders. Anxiety creates hormone disorders. It disrupts our immune system so that we end up with autoimmune conditions. let's see, anything, respiratory disorders,
Right,
right?
yes,
So we could
definitely.
look at this as perhaps allergies you mentioned, and maybe even asthma being triggered by an anxious state or prolonged anxiety state. You mentioned migraines, that's more of a vascular disorder. But when we think about the many things that are on this apple tree, the many apples on the apple tree, what you're saying is that all of these can be traced back to a simple root of anxiety?
Right. So that's why you want to get treatment right away, whether it's you learning how to manage your own state or if you need therapy to go into therapy and just work with someone, you know, in a cognitive behavioral sense to bring control to, you know, the attacks that you're having. So early onset is when you need to begin treating it so you don't have the disorders and illnesses that come from it.
Thank you. Now, you mentioned cognitive behavioral therapy and anxiety, and we're talking about very serious anxiety by the time you get to that state where you really need that kind of help. What do you think the success rate is from working with cognitive behavioral therapy and anxiety if someone was truly in that kind of paralyzed by that anxious state?
Well, you know that I did research in this area, and I did have an institute where we were looking at, you know, the anxiety and stresses that were driving people's illnesses. And so as we went through it, it was a marvelous time because people were getting such help from just learning how to manage and to control, and their bodies begin to respond, the illnesses begin to dissipate. And so I don't have an exact number for you, but in our situation, everyone was helped.
So you were nearly 100% in yours.
I would claim
right?
that for myself, but I
Good
can't
job.
say it is a
Good
general
job.
rule.
Excellent. So nearly 100%. And, you know, in preparation for our program today, one of the things I did was look back at the success rate of cognitive behavioral therapy and anxiety. And the 2-year success rate was 75%. 2 years, 75%, as opposed to many medications who only had about a 30% response rate over a 2-year period of time.
Amazing.
Yeah, so cognitive behavioral therapy and anxiety, a very, very powerful tool, even much more powerful than many medications. Of course, every case is individual, and we want to make sure that we're dealing with appropriate health care by appropriate health care professionals. However, one of the things you also mentioned was self-care. What things can we do that can help us cope with this anxious state?
Well, I think one of the things that I taught early on with my clients was how to breathe and just doing the simple diaphragmatic breathing, because what you want to do is to calm down the parasympathetic nervous system. So you need to get involved with, you know, learning how to breathe right. And that's in through the nose, hold, fill up that abdomen and diaphragm until you distend it. I always told people, I know I don't like to do it either, because who wants to distend your stomach? But you know, you need to. And so, but I would teach them how to do that, and then release out through the mouth and let it go out slowly. And you do that 10 times, and you're going to find yourself much calmer than if you did not learn how to do diaphragmatic breathing. So that's one of the very simple things we can teach people.
Wow, outstanding. Thank you very much. What a powerful tool, and it is essential number one. Now let's talk about another self-care technique. How about exercise? What do you know about...
Definitely was going to be my last point, but okay then, you want it now? You get it now.
That's right.
Because one of the best things that I had a therapist say to me when I was going through it at 30, he said, put on your running shoes. Really? And at that time, that's what they were called, running shoes. And so he says, get out there and get moving. And so I went out, you know, got my tennis shoes on and began to run at that time. And it was one of the greatest things that you can do to release the tension and the stress and the anxiety that builds up. So, you know, I definitely encourage people, you know, get a pair of good shoes, get out there, get walking at least.
Sure. And do you have a recommendation on amount of time?
Definitely 5 times a week, 30 minutes.
30 minutes. Those are minimums.
Yep,
5 times
that's right.
30 minutes most days a week. Right. Okay. Very good. Now, sorry about jumping ahead. We did get to the first and to the last, right? And we'll know that there are many things in the middle, and we want to be able to get back to those and have an opportunity to have you come back and chat a little bit more about this chronic condition that affects most people in industrialized worlds, which really is anxiety. Now, having said that, we recognize that health only comes from healthy habits practiced every day, such as deep breathing and exercise. Some really excellent other techniques that you might consider using. Many people who have deficiencies are also quite anxious. And so using a vitamin B12, especially sublingually, can make a huge difference in your anxiety profile. And also an adaptogenic herb called Rhodiola rosea, which is found in Adaptogens 10 Plus, is just magnificent for reducing the sensation of anxiety. As we continue to practice our habits every day and get rid of the root, we can use nutrients to also help us cope with those anxious feelings. This has been a wonderful time. We'll get you back here someday soon, but thank you so much for joining us.
You're welcome. Enjoyed it.
You're very welcome. And we'll talk again.